A knife given in the hand of a predator can kill a person. Similarly, in the hand of a surgeon can save a life. Same way,
The word obesity is often hated or disliked by people who are even affected by it.
obesity is a disease. It is a disease of modern life.
We had a 36-year-old young lady who came to me with few varicose veins. After seeing her, examining her, I said, reduce your weight because you're overweight. She looked at me angrily and said, Doctor,
There was an incident 20 years back when a surgeon was taken to court because he told the patient that you are obese.
Ozempic was the one which was most famous, but Monjaro, now that it's available,
Very good medications, they are a game changer. There is no medicine in the world which does not have a side effect.
you mentioned that many Indians have the famous pot belly. Some people even considered it as a sign of prosperity.
When a person gets cancer, you don't blame the person for getting a cancer.
Low carb versus keto diet.
Low carb diet. Most of the Indians, when they get obese, they would have more fat in the tummy, so they'll be having a big paunch. But when you will see the white or the Caucasian, they have a lot of.
The number of people who can be called overweight or obese has increased to almost 4 times since the past 20 years. And surprisingly, this obesity affects women more than men. And if we tell the total numbers, maybe worldwide around 650 million. Yes, that's 65 crore people are affected by obesity. If we go with Google and look at the searches, there are more than 1 million searches made every month about how to lose weight. Such a common topic and so many people searching for it. And the number of searches have increased a lot since the past 2 years when Ozempic, Monjaro and other GLP-1 agonist medicines have started being used for treating obesity. But the internet is sometimes full of myths and lies, and the real truth sometimes is hidden from all of you. So in today's eye-opening podcast, we are glad to have a very special guest, renowned laparoscopic and bariatric surgeon Dr. Pankaj Khandelwal, who has been one of the pioneers of bariatric surgery in Central and South Gujarat with over 25 years of experience. And he will bring to you a lot of myth-breaking facts and what science says about weight loss and obesity. So welcome to our podcast, Pankaj sir.
Thank you. Thank you for the invitation.
So we start with a very recent incident that I noted, and just a week ago, we had a 36-year-old young lady who came to me with leg pain, heaviness, and few varicose veins. And like they always do, they had researched on Google, searched my name, and they had come prepared to get the veins fixed or treated, searching for solutions for her problems. After seeing her, examining her, I said, your veins are still in an initial stage. We don't need to do anything for that, but you have to be more active. You have to make certain lifestyle changes and reduce your weight because you're overweight. She looked at me angrily and said, Doctor, I have not come to you for my weight. I came for my vein problem. So how can you as a doctor tell me that I'm obese? So that's when I understood that the word obesity is often hated or disliked by people who are even affected by it. And I'm sure as a bariatric surgeon, you would be seeing such instances on a daily basis. So would you shed some light on it?
Yeah, that's very interesting. Obesity is a word in the West. There was an incident 20 years back when a surgeon was taken to court because he told the patient that you are obese. So it can be extremely sensitive at times. And what we find is very similar to your experience. When I get patients who come for hernia surgery, who would come for a gallbladder surgery, and they are obese. And if anybody talks to them about the obesity management, they don't like it. They have come for a specific purpose and they want only that purpose to be fulfilled. Now, there is the other group of patients who are suffering because of obesity. Patients who would be having diabetes, blood pressure, they would be having osteoarthritis knee. Life would be miserable. They would not be able to walk. They would not be able to do all the routine activities which you take for granted. Now, this is the type of patient who wants and discuss obesity and who wants a solution. The sum of these problems they have can be really mind-boggling, like obstructive sleep apnea, which can be a life-threatening condition. And basic things like having a baby infertility because of obesity, also PCOD, which makes the life of a person very uncomfortable. So these are day-to-day interfering things when it comes to obesity as a problem. And these patients are well motivated. They come with the problem, they have researched, and you discuss the different options and you're able to give them a good solution. And to be very honest, they feel very happy after we guide them through rather than being offended.
So I think it's the internal mental drive which decides how they would react to our advice.
Exactly. Because when they see it as a problem, they want a solution. When they don't see it as a problem, because their life goes on as normal, they're able to do activities, everything. Like I have had 150 kg patients who have come and told me, "Ki, sir, હું દોડી શકું છું, ચાલી શકું છું. Why do I go ahead and get the weight loss? It's not interfering in my life at all. I don't need to change it."
When we say obesity, so does the definition of obesity differ from us Indians as compared to the Westerners?
Not really, because how do we measure obesity is basically by the body mass index, which is in short called as a BMI, and it is the ratio of height and the weight. So your weight in kg divided by the height in meter square defines your BMI. And till date, that has remained the most common way, clinical way of defining obesity. So obesity for the Western population is defined when they are above a BMI of 30. For Indians, it is defined when we have a BMI of above 25. So for us, it is much lower because even at a lower BMI, we tend to develop more problems related like diabetes, hypertension, and the other problems of obesity.
Is that something to do with our overall height or?
It's got more to do with the genetic constitution, because if you notice, most of the Indians, when they get obese, they would have more fat in the tummy, so they'll be having a big paunch. There will be a lot of fat deposits in the buttocks. But when you will see the white or the Caucasian, they have a lot of fat deposited subcutaneously on the shoulders, on the back, and it is evenly distributed throughout the body. So we tend to have more of a central obesity. And obesity, if you see per se, over the last 20-25 years has gone up like dramatically. America is the capital of obesity with more than 40% people obese in the country. Correspondingly, India, we have lesser when you look at the total percentage, but when you look at the urban percentage, people in the metros, all the studies which have been done in the metros show that the obesity percentage is way above 40% and overweight people are almost 75%. So we are equal in the metros as compared to the Americans, but it is our rural population which makes the overall ratio look much lesser.
Right. So you mentioned that many Indians have the famous pot belly. And some people even considered it as a sign of prosperity. But I guess science has something else to say. And there's still a difference between belly fat and visceral fat. Even words like TOFI, like thin outside and fat inside. So could you guide us what these terms mean?
Yeah, this is a very interesting thing. And it was actually observed first time in 2004. And what they did was, there was an Indian physician and an American physician, and both the fat compositions were seen. Both of them had a BMI of 22.3. Interestingly, the Indian physician had a fat content of 22%, while the white Caucasian physician had a fat content only 9%. So we as Indians tend to have more of fat deposits in our body. And even if you do not just observe all around you, what you see is thin people, but they'll have a small paunch. And that is because we tend to deposit more fat around the viscera, around your liver, the intestines, in the tummy. We have that fat deposition. And that is something which is very worrying. It is called as normal weight obesity. And though the weight is normal, but the person has the same risk factors for diabetes, hypertension, cerebrovascular accidents as would a person who has obese have. So in the face of it, it will look like the person is absolutely normal, the person is absolutely good, but is harboring a disease which is going to cause problems in the long term. And why does it happen? Probably a little to do with our genes also and our lifestyle. As Indians, we tend to have a high carbohydrate diet. We are not physically active as much as we should be. And we also tend to have high energy content food like things containing more carb and fats.
Right.
So all these factors tend to give rise to more deposition of fat around the viscera.
Even I guess our overall protein intake, especially in vegetarians, is very low. Would that also contribute to the development of fat?
Definitely, because we are compensating that energy or the part of the plate which we eat. We are taking more carbs, almost 60 to 70% carbs in an average Indian diet. So that is definitely going to make a difference, and increasing the proteins and reducing the carbs is a way you would be able to get away. Living a fairly healthy exercise is right. You have a regular exercise life. You do that. If somebody is smoking or is taking alcohol, if they stop that, reducing the type of ultra processed foods which you eat, all these factors are the ones which are going to help you in getting rid of the visceral fat.
So when you say BMI, I know BMI may be easy to calculate, but are there any other very simple markers that can give a hint within a few minutes that there is possibility of being overweight or obesity?
Yes, we have the waist circumference. Like for Indian women, a waist circumference more than 80, and for men more than 90 is considered to be a red flag. And also you have the waist to hip ratios, but these are not clinically used on a regular basis. The commonest ones which we tend to use is the BMI and the waist circumference.
So obesity, yes, the incidence is increasing, and I guess there's an emotional side to it as well. So what do you feel is that emotional aspect which people who are overweight or obese feel?
Yeah. See, we live in a world where body image has become very, very important. Everybody wants a zero figure. They want to look at the best. Now, in this circumstance, imagine a person who is obese. And in our society, unfortunately, people make fun of them. There are sarcastic remarks, and people look down upon them, even discriminate them at the places of work and study. And that is more commonly seen in the children in school, and that affects significantly in an emotional manner, leading to stresses, depression, and a lot of psychological problems.
So who really is to blame? Because some people, they either feel ashamed or they fear being judged, and sometimes they blame themselves, sometimes their genes. So who is at blame when it comes to obesity?
So, that's very interesting. When I get patients who come to me, what happens is the relatives keep on blaming the patient. The person is blamed if you are not regularly exercising, you don't take care of your food, and that is the reason why you are obese. Now, unfortunately, when this person goes to a nutritionist, the nutritionist tells the same. Goes to a physical trainer, the physical trainer tells the same. Goes to the doctor, and the doctor says the same. So what happens is everybody keeps on blaming the person. But modern research is telling you something absolutely different. What modern research tells you is that obesity is a disease. It is a disease of modern life. You can blame Edison for that, for he invented the bulb and we could have light in the night time. And so our nights also became days and we keep on staying awake till late night. But there are multiple factors which are causing the effect. One of them is stress, and modern life has a lot of stress. Second is the type of food which we are eating. It doesn't have the right type of constituents. It contains chemicals. There are certain endocrine disruptors which are present. Plus, because of the busy lifestyle, lack of exercises, which makes a person's muscles go unhealthy. So these are multiple factors. And to make matters worse, we are not getting adequate sleep. And it's not only that, it's the altered circadian rhythm. When you go to sleep late and you get up late in the morning, you are basically disrupting your hormonal cycle, right, which is called as the circadian rhythm. And when the circadian rhythm is disturbed, your hormonal disbalance occurs, and that also leads to obesity. So obesity, when you look at the complete factor, is a disease. So just by undereating, you are not going to remove obesity, and just because you are overeating, you are not causing obesity. And that is which is very important for us to understand, so that we don't blame the person. We work along with the person, go along with them, and help them in getting rid of their problem.
That is really eye-opening, because that's something which I think most people are unaware, that it's not just the person, it's the environment around the person that matters.
And also, when a person gets cancer, you don't blame the person for getting a cancer. When a person gets a coronary disease or gets an asthma or gets any other disease, you don't blame the person. But when it comes to obesity, we blame the person. And we need to understand very clearly that obesity is a disease. It's not a person dependent thing. It is because of the overall factors which our normal body has developed a disease.
Since you say that obesity is a disease, it means that there is a science behind how to really fix it.
Yes.
And I'm sure that there will be a lot of scientific, evidence-based methods about a stepwise approach to handle weight loss as a journey. So could you give important principles to our viewers about how a weight loss journey should be initiated and who would benefit by which method?
Yeah. So weight loss, it is a stepwise, but it is also dependent upon what is the BMI of the individual, what are the targets of the individual, how much weight loss they are going to look at. So if I have to lose, just less than 10% weight loss has to be done. So less than 10% weight loss you can do by simple exercises, dieting, you would be able to achieve that. That multiple studies have shown that is the level which can be achieved by dieting and exercise. But suppose if I want to have a 15 to 20%, then I would need to add some medications to it or use the other endoscopic options like an endoscopic sleeve gastroplasty or a gastric balloon. These are options available if I want a 15 to 20% weight loss. But if I'm looking for more than 25%, 30% or more weight loss, then probably at the moment there is only bariatric surgery which gives us the evidence, because it's not only losing the weight.
Right.
We need to understand the biggest hurdle is not losing, the biggest hurdle is maintaining. And a lot of people are going to regain weight initially who may lose. And you might have even heard earlier, a person went to a gymming club and they reduced 25 kg.
Right.
You see them after a year and they're back to square one. So losing and maintaining are two important aspects.
So I think that's what they call the yo-yo effect. They lose fast, but they regain fast too.
Exactly. And that is why we tell people that you don't try a fast loss. Right. You have to try to lose weight in a slow manner, in a systematic manner, in a planned manner. So first you will have a phase of weight loss, then you have a weight maintenance program. Right. Unless and until you don't have a weight maintenance program, the weight is going to come back. So whatever changes you do, very commonly what people do is, like, there was this young boy who was a 30-year-old boy. He was 130 kg when he came and met me. When he was 120, he went on a strict salad diet, walked 12 kilometers every day for 3 months and he lost 30 kg. He reached 90. After 3 months, he stopped, he got tired of doing all this and his weight bounced back to 130 kg. So whatever changes you do, you have to plan those changes which you can sustain for a longer period of time for life. So minor changes, regular changes, sustainable changes.
So consistency beats everything.
True, very true.
So I guess most people who want to lose weight would benefit from diet and exercise. So a few small principles which they should be, really looking at, because there are number of dietitian, nutritionist and weight coaches who would preach number of different things. But as an expert, a few things that one should be careful about.
See, what happens is, I'll give you a small example. You do a workout for 30 minutes and you lose 200 calories. And you go and eat an ice cream and you'll get 450 calories. So the key to any weight loss program is the diet. So diet remains the key. Why do I want to do exercises? Because it helps me in maintaining the weight loss. And not only maintaining the weight loss, it also improves my heart, it improves my lungs, overall it improves my fitness. So the exercise is an associated point, right, but the main way you have to lose weight is by the diet control. And as I said, diet has to be not a very low calorie diet. You go on a low calorie diet. Suppose your body requires 1800 calories, for example. So you just reduce 300 calories a day, which is not going to be a drastic change.
Right.
And to lose 1 kg, you need to be negative for 7,700 calories.
Right.
So if you look with 300 kg deficit, in about a month, you would lose 1 to 1.5 kg.
Right.
So over a 6 month to 1 year period, you would be able to have a 8 to 10 kg weight loss. But that would be a technique which is going to be sustainable for you because you have done just minor changes to your lifestyle. So exercising for 30 to 45 minutes a day, which we can do for the most of the part of our life, instead of exercising for 3 hours, which you cannot sustain for life. Going on a diet of salad and soups and dudinu juice, that you can do for a few months. But if you just reduce one chapati in your diet every day in your lunch and dinner, that's a very small change. You add a little bit of salad, add a little bit of dal, and you will find that you would be able to sustain that for a longer period of time and get the required weight loss.
Yeah, so that's where the famous quote, that small steps, small changes,
Yes.
big impact.
Yes.
So there are a number of people who nowadays, with the availability of the medicines to treat obesity, we get inquiries from patients that we want to lose weight. We've tried out other means, but we want to go with something which is, medically proven. So there's a lot of hype around medicines. Ozempic was the one which was most famous, but Mounjaro, now that it's available, and Vigovo, both available in India. So could you share your expert opinion about the role of these medicines?
Yes. Like as medicines which were available earlier were at the most being able to give you 5 to 8% of your total body weight loss. And that also when combined with other modalities. With Wegovy coming, semaglutide coming, it was a game changer. That was the first medicine which was giving us an almost 15 to 20% of weight loss. So the interest in the medication suddenly increased. Now we need to remember one thing. There is no medicine in the world which does not have a side effect. That principle remains. But Wegovy has been around for almost 4 years now, used in millions of patients. Its safety profile is very good. The small minor problems like constipation, diarrhea, nausea, vomiting in some patients. Some patients could, there was in between the report that some patients developed pancreatitis, but subsequently it was found that it wasn't so. It was just coincidental. So no major complication or side effect of Wegovy or Mounjaro have been reported. Mounjaro also has been there for around 3 years now, since 2022. And both of them are giving very good weight loss. But you cannot take it by yourself. It has to be given to you either by a bariatric physician or by an endocrinologist, and has to be taken under their observation and guidance. The first thing is any medicine, because it is associated with side effects, we use it for a disease. So there is always a risk-benefit ratio. Right? So when the risk of the disease is high, then you can take the risk of the complications of the treatment, because the risk-benefit ratio is more on the side of the treatment. But if the risk of the disease, suppose I am just wanting to lose 5-7 kg weight, and for cosmetic reasons, no other reason, and I take the medications, they can have their side effects, they can have their problems, and I could land into bigger problem. Because here, it was not the disease which was being treated, it was just the cosmetic angle which was being treated.
So justified use by only select doctors is what you would recommend.
Very, very important. These are like a dual-edged sword. You have to know how to use it. A knife given in the hand of a murderer can kill a person. Similarly, in the hand of a surgeon can save a life. Same way, these medications, if not used properly, can be really disastrous, and you have to be very careful while using them. And specifically, when somebody is going to use them for a long term, because the long term safety and efficacy is still unknown. Right. They have been around only for 3 to 4 years. So it's going to take us another 10 to 15 years by the time we come to know the long term problems which could be associated with these medications. So very good medications, they are a game changer, and they are making life of a lot of people better, but we have to use them with caution.
From lifestyle, diet, medicines, we move on to a topic which is feared by many, bariatric surgery. And some people still confuse it with liposuction, thinking that that is a kind of method to lose weight. There are a number of myths with regards to bariatric surgery. So as an expert who has done hundreds and thousands of bariatric surgeries, you're the best person to tell our viewers the truth about bariatric surgery.
Yeah, bariatric and liposuction are two different things. Liposuction is a body contouring surgery, which is for cosmesis, while bariatric is to reduce the weight, to treat a disease, and to get rid of the diabetes, the blood pressure, and the other problems of obesity. So both of them are quite different. Now, one of the commonest things with which people come, or the myths with they come, is the fear of the surgery.
Yes.
But it's a natural fear, even if you or I have to undergo a surgery, we would have some fears. But sometimes they are out of bound. And that is more likely because of the ignorance and what they have just heard in the society, or I might have heard about somebody having a negative impact, and all those things cause the fear. The second myth which they come is that the weight regain problem, कि मैं surgery कराऊंगा और वजन तो वापस बढ़ जाता है. Like I had this lady who came to me, she was 130 kg and she had come from the US at that time. And she said, no, I don't want to undergo the surgery. She had been referred to me by a cardiologist friend who was their family friend, but she didn't get the surgery done. After 3 years, she came back to me and her weight was 165 kg. Now, when I operate somebody at 165, the weight is going to go down till 100, 110 and then stop. Right. But when I operate at 130, they will reach 80, 85. So your lower level changes. So these fears that the weight will come back, yes, weight does come back in 10 to 15% people, but the vast majority of people are able to maintain the weight loss. And if you observe most of the people who come with obesity, they say, 2 years back, I was only 100 kg and now I'm 120 kg. Yeah. So every few years, the weight is going to keep on increasing. So the longer the delay in the surgery they are doing, actually their weight is keeping on going up, and it is damaging the body as well, because their joints are getting bad, their heart is getting bad. Because imagine a body which is, a heart is supposed to take 70 kg weight. Now this heart has to take 140. Your knees are supposed to take 70 kg weight. They have to carry 140. So the load which we are giving to our organs is tremendous, which weakens them up and causes a lot of problem.
So how many people actually undergo bariatric surgery? Because the fear factor is there, and people who might be thinking, they get affected when they probably hear people getting it done. That brings the credibility to a procedure or a surgery. So how many people have got bariatric surgery done till date?
See, this is not a new surgery. Actually, if you see, the gastric bypass is almost a 60-year-old surgery when Mason in 1966 devised this surgery. Right. And people had been trying to find the solution, a surgical solution, since the 1950s. Right. So it's been there for a very long time. But what happened after 1999 was it started being done laparoscopically. Correct. So the risk factors reduced, the complications reduced, and we saw a sudden spike in the numbers. And US being the world capital, they do almost 200 to 250,000 surgeries every annum. Oh. About 6 to 7 lakh cases in the world are being done every year. And this number has been continuously increasing. So if you see over the last 20-25 years, millions and millions of patients have undergone this surgery. And that is the reason that we have been able to study this very well. Right. We know the exact way it should be done. It has evolved into a complete science, into a very good technique. And we are able to reduce the complication rates, give very good results. And not only that, we also know what care needs to be taken for the long term, so that patients don't develop any problems related to the surgery. And also, patients do not have a major problem of weight regain. So it's a very well studied science.
I think that's very well said, because to some people who probably are unaware of the background, they still feel it's experimental. But I would completely agree with you. It's scientifically backed and proven in millions. So I guess that would stand as one of the most important methods to treat people who really need this cure for obesity. And because many people are unaware of how bariatric surgery actually is done, and that's where the confusion about liposuction and bariatric. So could you, in short, simple language, tell our viewers what exactly you do in a bariatric surgery?
See, the good point, as I said, is it is a laparoscopic surgery. So you have 4 to 5 small holes, and through those punches, the surgery is performed. You operate today, and day after tomorrow, most of the patients are going to go home. So it's just a couple of days in the hospital. And within a week to 10 days, people can go back to their routine activities. And the scars also are also so tiny that it doesn't cause too much of a cosmetic problem. A fairly safe surgery. And over the last 25 years, as I've been operating, I can say it's a life-changing surgery. People come back and tell me कि साहब तुम्हारी हमारी life बदली काढ़ी. What work I could do prior to the surgery, I can do 4 times that work.
Right.
So it definitely changes the way people live. And specifically, like one person was there who was into marketing and who used to make films. He had stopped traveling abroad. And the reason was that he could not go into the toilet in the airplane because he had become so big. After the surgery, he wrote me a very beautiful letter saying that, okay, now I can live my life normally, I can travel internationally and do everything what I wanted to do. Some patients come back and say, okay, prior to the surgery, I would sit at the hotel and tell my kids and everybody to go enjoy the tourist place and come back. Now I walk ahead of them and they walk behind me.
Yeah.
So it changes the quality of life significantly.
So I'm sure that bariatric surgery would make a huge difference in the life of so many people. And a few practical tips about what exactly the procedure is done. So, and why is it effective?
See, there are quite a large number of bariatric procedures described in literature, but the 3 commonest ones which we see in India, the commonest in India and the world is the sleeve gastrectomy.
Right.
The second is the gastric bypass, and the third is the mini gastric bypass. In the sleeve, we only remove about 70 to 80% of the stomach is removed.
Okay.
So what is left behind is about 100 ml stomach.
Right.
So you take in 100 ml and you are satisfied. But over the next 1 to 1.5 years, it will increase to 300 to 400 ml.
Right.
Now a normal stomach will be anywhere from 1 to 1.5 liter in size. So in spite of it increasing to 300 to 400 ml, it's going to still remain 25% of the present capacity, which helps you in maintaining your weight loss. Simultaneously, a lot of hormonal changes occur, which help in the weight loss. The gastric bypass entails 2 components. You reduce the stomach size, but the rest of the stomach is kept inside the body only. And you bypass the intestine. So you bypass about 100 centimeters to 150 centimeters of the intestine is bypassed. So you get 2 components. You eat less and there is a malabsorption as well.
All right.
But over the long term, what is seen is that this malabsorption component, the body starts adapting to it and compensates. So in the long term, when you look after 10 years, the results of both the surgeries tend to be very similar.
Okay. That's an very impressive way to lose weight. You reduce the stomach size and maybe bypass it. And that's something which is easy for others to understand how it would be effective. And I would also want to know how it is effective in reversing diabetes, because diabetes, again, India is the diabetic capital. And I'm sure that many people have a combination of both. So how does bariatric surgery help to really cure or reverse diabetes?
Yeah, this is also a very interesting story. Initially bariatric surgery started as bariatric surgery. Now there was this very smart doctor who everybody noticed that after the surgery people would get rid of the diabetes. But everybody thought that because they lose weight, it's happening. Now there was this very smart doctor who was going through the notes and he found that people would start getting their diabetes under control 2 or 3 days after the surgery also. Their insulin would stop immediately after the surgery. Now that made him think that there was some other mechanism which was also involved. So what we saw as an effect, then we studied to find that it was because of the hormonal changes. Right. There are multiple theories, but the major factor, whatever it does, is changes the hormones in the body. It reduces the insulin resistance, and all those factors help in the resolution of the diabetes. But this diabetes goes away in 80% patients. It is going to come back in 5 years in about 30%. So 50% of the patients will have the resolution of diabetes. Right. At the end of 10 years, still 50% of the patients will have resolution of the diabetes. Interesting part is that for those who don't have a resolution, their medication requirement also drops down significantly and they get a much more better control of their diabetes. And that is one of the reasons why it's not only bariatric surgery nowadays. We call it bariatric and metabolic surgery. And even the names of the society, which was supposed to be like the American Society of Bariatric Surgery, was changed in 2007 to American Society of Metabolic and Bariatric Surgery.
Okay, good. Because metabolic syndrome, I believe, has also been on a really rampant rise, and it's still so under-picked up, under-recognized. And I agree that bariatric surgery would be a key integral part of managing the metabolic syndrome as well. And because as a vascular surgeon, we see a lot of patients who have excess weight and end up developing vascular complications. It's both on the arterial side, artery blockages, as well as the pressure on the veins, which gives rise to venous insufficiency and varicose veins with a higher risk of DVT. So, what is your take on weight as a risk factor for vascular problems?
Very, very important point, a very significant thing which you have pointed out, because one of the dreaded problems of deep vein thrombosis as a bariatric surgeon I have is the deep vein thrombosis and the pulmonary embolism, which can occur secondary to that. And that is why we take tremendous care in preventing that. And all the studies have shown that if the right care is taken, then the incidence drops down significantly. The steps entail mobilizing the people prior to the surgery, putting them on DVT pumps at the time of surgery and after the surgery till the time of discharge, giving them low molecular weight heparins, as well as mobilizing them as early as possible. Most of our patients would be walking in the evening of the surgery only. And these factors do reduce the complications related to the vascular surgery.
Right. And I guess because there was a fear in many about deaths after bariatric surgery, and I guess this thrombosis and embolism may have a very important role to play in those particular cases. But when we are very careful, I'm sure the incidence is brought down to a bare minimum.
Yes. Now see, bariatric surgery and other surgeries, there is a big difference because patients otherwise do not have a disease in their mind.
Right.
You know, when a person comes with a cancer, they know that they are going to undergo a surgery, it has its problems and all. But when people come for bariatric surgery, so we tend to be far more careful. They are investigated extensively prior to the surgery. All sorts of investigations about their body are done. They are prepared very well. And what is very important is because obese patients are more prone to anesthesia-related problems and complications, what we tend to do is we have to get specialized equipment for bariatrics. So you have to have the right kind of anesthesia trolley, the monitors, the operation theater table, the beds, and the stretchers, and everything has to be specialized according to the bariatric patients. And to reduce the complication rates, you have to do it in tertiary care centers where you have got all the backups to deal with it. And what is very important is that bariatric surgery is not a single person's job. It is basically a team. So in the team, you have an endocrinologist, you have a bariatric physician, you have a bariatric anesthetist, you have an endocrinologist, you have a physiotherapist, you have a nutritionist, and in case if required, you have a psychologist. So it's a team, a multidisciplinary team performing the procedures in a tertiary care unit is what reduces the risk factors in a significant manner.
All right. And thankfully, in Vadodara, we are pleased to have you heading the department at Adikira Hospital, and you've been providing services for both laparoscopy, bariatric and GI surgery for so many patients. So a common question which arises to many, especially those who are probably thinking of bariatric surgery, is ki cost kya lagega? So could you give us an idea about what costs one would expect when they really wish to go for bariatric surgery?
See, the cost of these surgeries varies from hospital to hospital and city to city. The metro cities will have more charges. But in cities like Baroda, it ranges anywhere from 2 lakhs to 4 lakhs, depending on the room category which people take. And it's not only costly because of the staplers which we have to use, but also because we need to get a lot of investigations, take a lot of care.
Right.
So to improve the safety profile of the surgery, the cost goes up. But when you start comparing it to other surgeries, say like joint replacements or a bypass surgery for the coronaries, or for cancer surgeries, you will find that it is almost equivalent.
Right.
Nowadays, it isn't that expensive as compared to the other surgeries as well.
Right. And I guess now it's being covered by the insurance companies as well.
Oh, yes, yes.
So that probably makes a huge difference when people want to decide
Yes.
whether they undergo this procedure or not.
Yeah, because earlier it wasn't considered. It was called as a cosmetic surgery.
Correct.
Then subsequently, it was obesity as a disease was identified, and obesity surgery as a GI surgery was identified, and then it was regulated by IRDA that all insurance companies have to cover up for bariatric surgery as well.
So that's at least some good news for people who really would be considering for bariatric surgery. One is that the cost is not out of reach, and in case someone has an insurance, that also would be useful to get the treatment done. So for those who are really considering getting a bariatric surgery done, yes, the cost range has come into a slightly affordable range too. And the good news is that insurance companies also would allow for this surgery and reimburse for it. So those who really are feeling whether they should take the plunge to get a surgery done or not, well, I'm sure that these factors should help you decide when to get it done. And as Dr. Pankaj rightly said, the earlier the better. You really nicely explained how the surgery is done, what the benefits are. Some people they would be okay for the surgery. The fear is about the post-operative period. Will they be able to eat well or not? Will they feel weak or not? So what exact post-operative care would you recommend to someone who is willing to go in for a surgery?
See, the post-op care is not very difficult. And once we operate, we would normally keep the patients. I tend to keep my patients for a month on a liquid diet, followed by a month on a soft diet, and they go back to a normal diet. But interestingly, for about 6 months, they won't be able to eat more than half a chapati. By the end of a year, they'll be able to eat 1 chapati. And after 1.5 years, 2 chapatis. Right. And most of the patients in a single go would not be able to eat more than that. Right. And that is one reason that in the first 1.5 years, we need to supplement these people with protein powders. So that, and for life, they would need to take supplements of vitamin B12, calcium, D3, and in case if required, iron or trace elements as well. Because once the stomach is reduced, the absorption of these vitamins gets hampered. Over and above that, the quality of life doesn't change at all. They are able to lead a better quality of life. There is no weakness at all. I tell my patients that if in the first 2 months you feel that you have weakness, that means you're not taking enough water. If after 3 or 4 months you feel you have got weakness, that means you're not taking enough protein powder. Okay. If you take these two care, you would not feel any weakness at all. And as I told you, some of my patients tell me that they can do 4 times the work what they could do earlier.
Right. So yes, so some of these fears are mainly in the mind, but maybe if they're more careful, they should be able to handle it in a much better way.
And there is a long-term observation also, because in the first 6 months, we would test their blood test to make sure that there's no deficiency at the end of the year, and then every year.
Right.
They just need one blood test every year to make sure that no deficiencies are coming.
Thank you for all the information, but we won't let you go without a quick rapid fire. So you won't have time to think, and they're just questions where you answer fast. The first question is low carb versus keto diet.
A low carb diet.
Keto is still very popular, but low carb is what you still recommend. Yeah. The second rapid fire question for you is whether Monjaro versus dieting.
Preferred dieting, no option than Monjaro.
Bariatric surgery versus the endoscopic balloon.
Bariatric surgery, it is a long-term solution. Balloon, the weight would rebound back.
When it comes to exercise, cardio versus muscle or strength training for weight loss.
Combination of both. That is the best way of doing it.
And bariatric surgery for people who are severely obese, early or late?
As early as possible, before the body is dead.
Well, so thank you for answering these. And I'm sure that viewers who have watched till here have gained a lot of knowledge about weight loss, obesity, what methods are available. And thank you, Pankaj sir, for sharing all your very valuable inputs and expert opinions about multiple factors, not just bariatric surgery, but weight loss in general? And on an ending note, would you have some inspiring words for our viewers to share?
See, obesity is a major problem for the world. Whosoever is facing that problem is not alone. There are a lot of people. And so much of research and work has been done on it that we have very good solutions, long term solutions, and you could be able to get rid of the problem and be able to live a comfortable and a good life. Being able to do everything personally, professionally, and with more confidence and develop in life as you would want to.
Thank you so much for spending your valuable time with us.
You're welcome. Thank you.